So it's been a real pleasure to work with Patti Burke over the last 3.5 years as my patient. Um, so Patti, I think, so Patti is a nurse by training.
Yes.
So I think that gives her a little bit of an interesting perspective. And I'll just tell you a few kind of fun facts about Patti. So Patti actually, for the last about 10 years of her career, was a school nurse, coincidentally at my daughter's school in Estes Hills in Chapel Hill.
Just a couple of miles from here.
Yeah.
Yeah.
So, but again, like I said, I think you'll agree that gives Patty a really interesting perspective. Another fun fact about Patty is she is now dating the childhood friend, best friend of one of my other patients.
Yeah.
And so it's been really great to see Patty find love and really thrive, with kidney cancer. So after those fun facts, I know Patty has a great speech prepared, and I'll maybe break in with questions, but
Yeah, please
I'll let
do.
you tell your story.
You're going to need to call time. Okay. So I recently celebrated a miraculous 71st birthday. And at one point, I wasn't supposed to be here, but I can assure you that I very much am. And I'm also a UNC alum. I graduated from UNC Nursing School. And, I'm here because of the doctors, Dr. Harrison and the other doctors in this room. I hope my story will inspire you and give you hope. My cancer story started as an elementary school nurse, and I was working during the pandemic and got sick during that time. And it took 6 months before I got my diagnosis. My first symptom was weight loss. And I thought I retired. So when I lost this weight, it was because I was finally sleeping, which created intermittent fasting, and you lose weight from intermittent fasting. So I thought, well, I'm just sleeping a lot and I'm dropping this weight, which was a good thing because I was overweight. And when I was finally seen by a doctor, there was more weight loss, there was appetite loss, and then I was diagnosed with severe anemia. And there were lots of barriers with getting care. I was due to go to Duke hematology, but you have to jump through the hurdles and check off boxes, take this useless iron for a couple of months, have more blood work. I finally got into Duke hematology, and they ruled out everything from lupus to leukemia and back. And they said, well, just watch and wait. Maybe it will disappear as mysteriously as it came. So this was all during COVID. And I had this really odd headache like I'd never had. And I scheduled an appointment on a Friday afternoon during a rainstorm to have my head have checked for COVID. And I had to see a doctor in my practice that I'd never seen before. And I'd been followed monthly for about 4 months. We weren't finding anything. And she ruled out COVID. And I was the last patient in that clinic that day during a rainstorm. And this doctor said, I don't like what I'm seeing on your chart. I'm really kind of shocked and appalled. What are we doing for you? What is going on with you? You are really sick. And do you mind if I examine you? And I was like, I'd love for you to. Well, she said, there's a huge mass on your right abdomen. And she scheduled an urgent scan within the hour. And I went over to what I call Duke Regional, and the technician said, I'm not supposed to say this, but there's something big and bad going on that explains all your symptoms. So in the storm, I pulled over and read my chart, and my vision just blurred. It said huge in all capitals, huge 11-centimeter mass. So then I met right away with the kidney surgeon at Duke, and scans were done. And he called me within a week and said, I'm really sorry, I can't do a nephrectomy. You're too sick. You've got a lot of metastatic sites. And that included, Dr. Harrison can help me here, but I'm remembering my pancreas, my other kidney, both lungs, and the headache was caused by a lesion on my skull. Fortunately, not in the brain, but the skull. Was that all?
That's correct.
That all? That was enough, right?
Yeah.
So it was really what Dr. Harrison calls a heavy disease burden. So then I get to see Dr. Harrison right away Duke does a great job being very efficient, getting me right in. I have the privilege of coming to my first consultation immediately with Dr. Harrison, with my only child, my adult son, by my side. And Dr. Harrison fills us in, and my son asked to see him privately and ask him what my prognosis is if I don't elect treatment or if my treatment wouldn't work. And Dr. Harrison, as I recall, said 6 to 7 months. I mean,
Yeah.
I repeat, 6 to 7 months.
So if I can break in, so on that IMDC curve that I showed you, Patty was technically poor risk because she had 4 or 5 risk factors.
Yeah.
And maybe I can ask a question.
Yes, please.
So I know that Patty seriously considered hospice and supportive care and not getting treatment. So maybe you could tell everyone like what your thought process was like.
Yeah, well, I don't recall really considering it. It was interesting. I mean,
You at least
Dr.
you asked about it more than most people
Okay,
do.
and I remember Dr. Harrison
Yeah.
offered it. He's presented my case, and when I've read it, he considered offering me hospice. Um, it was interesting. I was very afraid, and that's another. I was afraid. I also was an oncology nurse, and that was my love. And
And that was
I
in,
did
like,
that
the
in Washington,
1980s.
D.C. in the 80s. So when I got sick, I knew in my core that I had cancer. As a nurse, I knew when you lose 30, 35 pounds in a couple of months and you can't eat, you know that you've got cancer. And there were a lot of problems. This was during the pandemic. I had lost my doctor. I was trying to find a new GP. Then once I got in, there were all these hurdles and all these delays. But I knew, but I never had the courage to insist on a scan that would have diagnosed me earlier. And it was because I administered chemotherapy in Washington, D.C. in the 1980s, and that was the old paradigm where most of the treatments, I mean, it really was a war against cancer. The treatments were waging war, and there was a lot of just a lot of fallout and tragedy and horrible side effects and sometimes fatalities from that. So I really felt like there was no hope for me. I hadn't kept up with the literature, and I didn't think there was going to be anything that could be done. So I thought that that's what I was going to need. And I wanted to live. I had a single goal, will to live, and it was to get my financial, business, and my will in order for my family, which is small. I have one older sister and one adult son. And that was my pure goal. I mean, I was so sick. I was dying. And it's just amazing how sick I was. My son came home from Wilmington, left his home in Wilmington, and came and lived with me to take care of me. And he shared that every morning he would get up and come downstairs and look in on me to make sure I was still breathing. When I went to the clinic, I've never seen anybody at Duke look sicker. I mean, I'm sure Dr. Harrison has, but when I went in for Dr. Harrison offered instead of hospice that I asked about, immunotherapy, the two immunotherapy drugs, and you can name those.
Yeah. So ipilimumab and nivolumab.
And I had those for 6 weeks, every 3 weeks for 6 sessions. And I wanted to do it. Interestingly, once I was told I had cancer, it was kind of a relief. I mean, I had been through, all the grief that you go through for death and dying. I accepted my death. That came first. That was my first stage. I knew that I was dying and I didn't expect to live. But once I met Dr. Harrison, I wanted to live long enough to get my affairs in order and say a proper goodbye to my friends and family and get the finances in order. And that was really my goal. So, but then once there, I wanted it. That's why I wanted the treatment. So, yeah, I couldn't even sit up. When I was waiting for my infusions, I would sit on the floor in the waiting area at Duke with my head in a chair. I literally could not sit up.
So yeah, so if I can interject, so Patty was sick enough where, I worried if I treated her with one of those pill, TKIs, which also you didn't really want, that would have made her feel much worse. And so she actually is an example of some of those patients in Odyssey that were probably did not have a good enough performance status to enroll in the trial, but still,
Right.
obviously, and you can tell the story, but benefited from this combination.
Yeah. I didn't qualify for the trial also because I was so anemic. My hemoglobin was below 8. It was in the sevens. And all of these trials, as I recall, that Dr. Harrison had, the experimental trials required a minimum hemoglobin of 8. So and my sister says, you were too sick to be a lab rat at Duke. That's what she would say. So I was sick. I knew I had cancer. I knew that things were really bad, but I wanted to live to get things in order. But interestingly, this was amazing to me. Okay, here I go through this treatment for this is June when I meet late June when I meet Dr. Harrison. We start by October 3rd, the month of my birth. I woke up. It was like a light switch came on. It was like I was struck by a bolt of lightning that gave me this new energy and a ravenous appetite. It was literally like night and day. I woke up, and what had happened, my hemoglobin from my anemia had come up to almost 11 from the 2 immunotherapy treatments. And I literally woke up a different person. I called my son down and said, Andrew, take me to Grub Durham for the biggest breakfast that I can eat. And my girlfriends came from all over the country and took me out every day to eat. And I ate, and I felt almost well again. It was just immediate.
So yeah, so Patty had a really nice, just clinical response within 6 weeks, where she really felt like a new woman,
Yeah,
and
I
she
did.
and looked it too. But if I can just add, so confusingly on the scans, her scans showed a
A
little
mixed
bit,
bag, a
yeah,
mixed bag, he
mixed
called it.
response, a little bit better, a little bit worse. So we didn't really know what to do, and this is where we had to kind of go outside of the evidence, but we added Cabometyx and kept one of the immunotherapies going, nivolumab, and that worked really well.
Right.
So do you want to, I think we're probably getting close to time, or we have about 5 minutes. So,
Okay.
so maybe you can tell them about like, what are some of kind of the key events where you had decisions to make?
Well, I do want to say that chemo pill, I'm so thankful for it. It was not federally approved until 2017. So every day when I take it, I look at that and I'm just so grateful for it. It was kind of tough. I think, David, you're on 40 milligrams, right? I started on, did I start on 40?
You started on 40.
Yeah, I started on 40 and it was tough. I didn't really have that hand foot thing, but it was more like I had severely sunburned legs. My entire legs would radiate heat and they almost blistered. And my blood pressure went up really, really high. So Dr. Harrison was saying most of the studies are on men, and he put me on 20 and we got the dose right pretty soon. And it did really well. But what was your question to me? The,
Yeah, if there's any kind of key decision points that you want to talk about.
Well, other things just to note, Dr. Harrison, and within about a year, I did so well. And then he said, I'm going to take your case before what I call the tumor board. And they approved.
Multidisciplinary conference now.
Okay. I knew it wasn't
yeah.
the tumor board anymore, but that's so easy, right? And they approved, and I had a radical nephrectomy, but I had it with robotic surgery. And I did great with that. Absolutely great. So I get that. And then Patrick Corrigan is the nurse practitioner that works on the team. And he said, Patty, busy people do well. And I got busy. And I just did want to share that my best friends from high school, had this live memorial service for me that I always wanted. When I worked in oncology, my favorite thing that I would hear from patients that inspired me the most was that they got to have their live memorial service. It's kind of like if you've seen Meet Joe Black, the character that Anthony Hopkins has his 65th birthday before his death with the fireworks and the live music. Well, it was just like that. It was fabulous. And I loved introducing all my friends and getting to thank them. So I did that. And I'll skip all this stuff about my divorce and all the things that I did that helped me when I got cancer, how I reinvented myself and all the wonderful things that I did again.
You could talk
You
about
know,
that.
well, no, I should. I'll skip that. And but I started to think about things on my bucket list that I had been afraid to do. And one thing was to play the violin. And as a little kid in elementary school in Burlington, North Carolina, uh, I played violin. I was picked, in first grade by this guy named Dr. Artley. And what happened was he was so strict and he made me do solos and I would tremble with performance anxiety and I quit. And I always regretted that. So a year ago, I picked up the violin again. And now my boyfriend Sam, who's here, calls it the Cat Scratch Orchestra. And he has to put up with listening to me, he and his beagles on his farm. But I do really love it, making the joyful noise and just overcoming that. And it's just a supportive thing in Durham called Indie Strings. And we perform at the Armory quarterly. And Sam comes with my friends and my family and calls bravo, bravo, and brings me flowers. And that's been a fabulous thing for me. Just I think when you have cancer and you're on your deathbed, literally, and you come out on the other side and survive it, you just really, it is the opportunity to embrace life and to reevaluate your life. I think there are times you do that, like maybe when you become a parent is one of those times, or when you have a major life crisis, lose a spouse or divorce, or have cancer that's metastatic, that isn't going to be cured, you have the chance to reinvent yourself and to really evaluate and do these things that you've been too afraid of. The other thing I was afraid of was love. And I divorced as a 50-year-old after being married my entire life, 30 years of marriage in college. I got married in college. And I did a lot of things. I did a lot of travel. I did a lot of dancing with people, but I was too afraid to put myself out there again. And so after having cancer, I did. I'd had a crush on Sam in third grade, and we used to roller skate together in Burlington. And I knew before our reunion that was like a connection, what an amazing man he was. And I let him know. And I said, if I didn't have this cancer, I'd ask you out. And he said, well, that's okay. I have a lot of other friends, with cancer that have been through everything, radiation, all of it. Let's see what happens. He said yes. And the rest is just this amazing love story. I mean, I have this amazing love of my life with terminal cancer. It's just miraculous. And it's like a Hallmark movie, right? Your third grade crush and love. So, and he's here and he surprised me sitting right there.
Maybe that's a good thing to end on, that you can reinvent yourself and find love even with cancer. And
Yeah,
it gives you the opportunity
it does.
to do that, maybe.
It does. And thank you, Dr. Harrison.
You're welcome.
But
Thank you.
I do think you need to know, though, that Sam and I went to, in late September through October, we went to Switzerland, where he has very dear friends that are like family, and now they're mine. And we traveled. But while there, right before we went, I had to go have dental surgery. And if you've seen on the slides, when you have, um, when you're on Capomedics, it causes poor healing. And I had to go off my Capomedics to have the dental surgery. And I stayed off. We were going to try for about 3 months. And because my scans had been so stable. and I developed back pain over in Europe a little bit, not too bad. Came back, saw doctor, had scans the very next day, I think, when Sam and I got back in September. And unfortunately, the cancer is back in my spine, and it's not just the bone, but was wrapped around the spinal cord. And it also is in my brain. So I have had 5 days of radiation in October to my spine, and 3 days of radiation to some little spots in my brain that I just finished on 11/11. Was that 11 days ago? I just had brain radiation. And so that's a great lucky date, I think. 11/11 is a lucky wish date. So Dr. Harrison has me back on Cabomedics. And it might have been said today that that doesn't work again, but it is probably working. Cross your fingers for me for my scans in January. But my hemoglobin had dropped right before Sam and I went to Europe, and we didn't quite know why. And the cancer's really very sensitive. That anemia is a real marker, and it is all the way up to normal now for the last 2 times. So we're thinking that
Thinking that
we're having
Cabomedics
some
is working
response.
again. We haven't had the first scan. But
Yeah. So, thank you. Thanks, Dr. Harrison.
Thank you so much for sharing your story. We all love to hear it.
Thank you all for listening.
We are going to
I
take,
wish everybody well. I do want to say, I'm not cured and never will be, but there's a big difference between curing and healing. And Dr. Harrison and the team have healed me. Healing is about feeling whole and having inner peace, and a cure is about getting rid of disease in your body. And to all of you with kidney cancer, I wish you a cure, but if not a cure, I wish you a cure and healing, both, but I wish you healing to be whole. I got it.
thank you.